All right. My name is Kamyar Hedayat. I'm the co-founder and chief scientific officer of Systems Biology Research Group and the chief architect of the GEMMA bioanalytical system. So I'm going to give you, as I mentioned, a very brief discussion and introduction to the theory of endobiogeny as an approach to global systems thinking, and the Science of Endobiogeny course. So let's first talk about endobiogeny. Endobiogeny is a whole systems approach to medicine, and like our friends who practice an Eastern approach to whole systems thinking, the distinction I just want to make here is how the system is characterized, and only to say that not a comparison of better or worse, but just to understand that there are different languages and I think different levels of describing the system. But I think it's fair to say that especially the East Asian and also the Southeast Asian, the Ayurvedic approach, describes the system in terms of forces and elements. In endobiogeny, because it was something which was developed as an approach to medicine in the 20th century in Western Europe, the whole systems approach is based on describing the physiologic elements and forces which manage life. So basically, we can describe endobiogeny as a theory of the interconnectivity of all living beings and all elements within a living being, and how all the elements of metabolism, physiology, perception, and psychology together maintain health and manage disease. The advantages of this approach in our time and in our locale is that it brings a respect for the whole person back to a Western style of approach to medicine that's based on a biomedical model. It's rooted in contemporary science, in the language of physiology and clinical trials, and it utilizes standard medical as well as traditional healing modalities, because the power of endobiogeny is the fact that it remains an integrating and interrelating way of seeing the world and understanding it. So endobiogeny with a capital E, without the word theory of before it, is a philosophical approach to the concept of understanding the whole and the interrelationship with the parts. And I think those of you who are experts in East Asian medicine, or those of you who are trained in a Western biomedical approach but have a philosophical bend, will understand that everything remains relative and qualitative when we talk about systems and levels. Because if you were a cell, the cell is a whole system. And if you're a tissue, the collection of cells is your whole system. If you're an organ, the organ is the whole, etc. So even the human being as a whole living system is itself part of a larger network of other beings within its own species, and then within the greater ecosystem of the beings that live on the surface or just below the surface of the earth, and etc. You can go higher and lower in different levels of organization. So this endobiogeny is something which is much bigger. So I'd like to explain it to you with one of the poems I've written. I've taken the Tao, the Tao Te Ching of Lao Tzu, and I've rewritten all the poems from an endobiogenic perspective. And so this is for Analect number 4. It's called The Non-Origin of Endobiogeny. Endobiogeny is like an empty vessel. No amount of scientific references can fill it up. No amount of clinical trials can prove or disprove it. Vast and deep. It seems to be the ancestor of many theories. It blunts didacticism, untangling lines of cause and effect. It softens polemical arguments and clarifies the inexplicable, clear and deep. it seems to have been there all the time. I don't know whose child it is, but it is an expression of what was before Dufour's theory itself. This is why we're having this conversation, because endobiogeny in this level is a meta philosophical tool of reflection and analysis, and all other systems can be viewed within it. So we have standard biomedicine, which is a non-integrative approach to physiology. And you have various offshoots, I would say, like functional medicine, which is a type of holistic biochemistry. And earlier than that, we had orthomolecular approach, which is like a functional biochemistry. And you have the theory of endobiogeny, which the Science of Endobiogeny course is going to teach you about. And this is an integrative, physiologic-based whole systems medicine. And it is informed and grew out of the observation that the standard biomedical approach needed to be expanded and returned to a holism. And ultimately, if you will, the mother of the theory of endobiogeny is endobiogeny, which is a perennial way of thinking across all cultures and all times that human beings have sought to explain the part and the whole and the relationship. So, from our perspective, the theory of endobiogeny and the practice of endobiogenic medicine encompasses all of these approaches here, because we're working in the same language, but we're integrating and interrelating and moving back and forth between the different levels of a human being and beyond the human being, and its integration in a larger social and cosmic context. And we have pre-modern whole systems medicines, such as the various East Asian medical approaches, Ayurveda in Southeast Asia, and Tib Unani, which is actually a fusion of Hellenistic medicine of the humors and Ayurveda, and also some East Asian medical techniques like tongue and pulse diagnosis. And I would say that the theory of endobiogeny and the pre-modern whole systems medicine have a bidirectional relationship, because as Rachel has pointed out to me and others, endobiogeny practitioners who are also East Asian medicine practitioners pointed out, there's a number of physical exam points in endobiogeny which directly correspond with specific meridian points. So I think that there's a nice bidirectional relationship and sharing of concepts and influence. And also, what the theory of endobiogeny can contribute to these pre-modern whole system medical approaches is the mathematical quantification through the measurement of biomarkers. There was a practitioner of Ayurveda. One was an endocrinologist, the other was a neurologist, and they were both trained in Ayurveda. And they had commented to me on how their pulse diagnosis could take 20 years to really master. But having the biology of functions, having a way to functionally evaluate the biomarkers brought a level of clarity that aided in reflecting on pulse diagnosis and also creating a language of communication with colleagues who are not trained in the specific pre-modern whole systems approach. I think there's also an interesting bidirectional exchange in how we use plants and understand plants, and how we can learn from each other in how to consider the actions of plants. And so this endobiogeny that I talked about in the poem encompasses all of these approaches. So in endobiogeny, we'll start to think more like this. You take something like anxiety, and we can think about it through all these different levels of relationship that are microscopic, mesoscopic, macroscopic, environmental, ecological, social, etc. Because it's important in endobiogeny to respect and utilize all the advantageous discoveries of the contemporary scientific approach. but to always build back up to the holism that represents the totality of the experience of life. And we can also look in this sense, in a more holographic and three-dimensional sense of the same concept of anxiety, different scales. And on the right here are some different levels of evaluation that just using blood, the biomarkers, the blood-based biomarkers, we can run this through our analytical system called GEMMA, and we can characterize all these different levels related to anxiety in an individual. So the theory of endobiogeny is based on the concept of dualism that would be, or dualistic and dialectic thinking, the interaction of forces. That life is metabolism, which is holism circumscribing a duality of catabolism, which is breaking down material and liberating energy, and anabolism, which is utilizing energy to reincorporate material. And this basic duality contained within metabolism is the essence of biological life, and really at all levels of the functioning throughout the universe. So the orderly management of metabolism is accomplished by the endocrine system. Otherwise, there would be chaos. There wouldn't be any type of mediator to regulate how much catabolism, how much anabolism, and how long each of these aspects, these forces, would be acting. Hormones are the master regulators of metabolism. They ensure this coherence, order, and a larger plan for the individual. This is what allows us to go from surviving to thriving. So I'm going to talk about the constellation of the managers of life overall, because the endocrine system doesn't function alone. And I want to kind of take an approach that you might find in the Tao or in other East Asian approaches. And we could say that one is life and two is metabolism, managed by the endocrine system. And three is the trialectic of the autonomic nervous system. We have three parts: parasympathetic, alpha sympathetic, which is expressed through noradrenaline, and we have beta sympathetic, which is expressed through adrenaline. And then we have a return to the baseline of parasympathetic, which is rooted or expressed with acetylcholine. Four are the hormonal families or endocrine axes, and five are the primary emunctories: the liver, the solid and the hollow organs, as you might characterize them: the liver, the kidney, the lungs, the gallbladder, the intestines. So when we talk about integrated physiology, we start with this concept of metabolism, and we look at this duality of catabolism and anabolism. And because we've stated that the endocrine system, the hormones, are the managers of metabolism, we can arrange the different hormones in families based on the general tendency for them to be primarily catabolic or anabolic. So we have these different hormonal lines that we'll teach you about and characterize how they function. And then here to your left, we have ANS, which is the autonomic nervous system that I presented to you just a moment ago, with parasympathetic, alpha sympathetic, and beta sympathetic. And the nervous system calibrates and fine-tunes how the hormonal system works. And then we have at the bottom of the screen the various emunctories that I mentioned, these organs of drainage and detoxification, and how they're associated with specific catabolic functions. There are also emunctories associated with the anabolic function, but we'll discuss that in the course. And then, of course, we have this overlaying influence of mind, of Shen, and how this influences, for better or for worse, how intensely the demand for metabolism is and how the nervous system and the hormones and the emunctories are functioning. With respect to the origin of disease, from the viewpoint of endobiogeny, almost all disorders are imbalances in the elements of physiology and metabolism. The origin of disorders is rooted in a disruption in the hormones. And so we categorize each disorder based on the initiating family of hormones as the location of the origin of the imbalance. and then the responding families, because sometimes, if I can go back here for a second, let's say a disorder is rooted here in this first line, in the corticotropic line. There are some disorders where this line is the origin and this family is the responding or compensatory line, and it's all about adapting to stressors. Sometimes it's these two together, the adjacent ones, and here it's actually about helping to adapt metabolism for the maintenance of a structure. So we look at these different combinations. Where does it start? What is a compensatory line? Is it adjacent? Is it or is it a shared activity? How many of these subsequent lines are implicated? We also look at the autonomic nervous system, and we look for disruptions in the sequencing of these three branches. The intensity of its activity, is it under or over expressing? The timing, is it coming too soon? Is it delayed? The duration of activity, etc. And then we look at the specific emunctory organs that are associated with it. Is the liver more implicated? Is the liver and the kidney, etc., etc. So the exception to this would be inborn errors of metabolism. So these would be like genetic disorders or traumatic injury. But even if a patient comes to us with an inborn error of metabolism or traumatic injury, the organism, the patient's terrain, their physiology has some type of characteristic response. And from the perspective of endobogeny, we can still treat the compensatory physiologic response, even if the origin is considered uncurable by the tools we currently have. So the essence of the practice of endobogeny is expressed in 4 elements. The first is listening, deep listening to understand the symptoms and to relate these symptoms to physiology. Examining, careful examination to determine the signs on the body that relate to the anticipated physiologic imbalances suspected by listening to the reported symptoms. The third element is evaluation of the biomarkers using our characteristic functional analytical approach. And the fourth is, of course, intervention. Now, the endobiogenic intervention is something that we would call rational clinical therapy, because the selection of the interventions is based on a triangulation of the history exam and the biomarker analysis. And rather than only treating symptoms or only treating signs, we seek always to go upstream to the highest level of the origin of disorder whenever possible in order to institute a treatment. Of course, the root cause treatment can also include symptomatic relief in the short term, but ultimately our treatment is a rational one and not based on guessing, should we use this plant that has androgenic effects or another plant that has androgenic effects. And so I'll present one more poem today. This is a poem or analect number 8 called Endobogenists Are Not Contentious. The best endobogenists are like water. They treat all but do not contend with them. That is how they come near to endobiogeny. In home and office, they love asceticism. In learning, they love profundity. In professional societies, they love competency. In collegial relations, they love courtesy. In consultation, they love deep listening. In treatment, they love simplicity. Because they do not contend with patients, colleagues, or medical societies, the best endobogenists are beyond reproach, and that is why they are near to endobiogeny. I won't go through all 4 of these elements, but I just wanted to point out from the semiologic approach, even if your license doesn't allow for palpation or only specific types of palpation, such as pulse diagnosis or HARA or something along those lines, there's so much information just by looking at the facial structure. And I know that you guys also do tongue diagnosis. In addition to tongue diagnosis, we can also look at the saliva, the quality, the abundance, etc. and actually very, very similar to a Chinese medical approach. We can look for things like inflammation on the tongue. Instead of calling it, let's say, I think you'd call it like a heart fire. We would refer to it as duodenal inflammation, and also looking for dysbiosis, hepatic congestion, etc. Briefly, I want to talk about our functional biomarker analytical tool. It's called GEMMA, which is Global Endobiogenic Mathematical Modeling Assessment. These are algorithms, mathematical ways of processing the biomarkers to uncover subtle or latent or hidden imbalances that are not apparent on a casual view and reviewing of the biomarkers. And these tools can be used for screening and prevention, diagnostic aid, and therapeutic aid. And there's a wide range of conditions that can be evaluated using the modeling system at a much lower cost than quantitative measurements with other functional biomarker evaluations. All the panels in the GEMMA system, every product that you could order, will include some combination of dietary advice, as well as a list of nutrients that are richest in certain foods or foods to avoid, lifestyle modification, environmental modification. There's a pedagogic section at the very end, which discusses the concepts to improve the explainability and the comprehension of the results. It explains, based on clinical studies, how we derived and created the indexes, why we've associated with a certain condition. And our most recent panels also include drug-drug, drug-herb, and herb-herb interactions related to what is presented in the panel for a maximum level of safety and compliance. So here's an example of some of the panels or products you can order. For example, it's just a simple blood count. You can evaluate adrenal function, and you can use that itself to help characterize tendencies towards fatigue, allergies, eczema, asthma, insomnia, depressive tendencies, infections, etc. This is the anxiety panel. There's a screening version of this test. This is the full version that would require a broader profile, but you can look at several levels of factors related to anxiety, neurotransmitter imbalances, hormonal imbalances, inflammatory issues, etc. Spasophilia is a tendency for the nervous system to be dysfunctional in its cycle of activity, and it's associated with over 50 or 60 different disorders. So just ordering this from a simple blood count can help give you insight into many, many different types of disorders. I think that some of the disorders that are characterized as pathologic wind from a Chinese medical approach are related in part or in whole to this spasophilia tendency. And I hope later on this year I'll also come out with my mental spasophilia panel, which will also start to look at pathologic wind and other related disorders related to mind. Well, let's look at a specific panel, which is the thyroid quantitative panel. Thyroid disorders are very common. I'm sure many of you see these thyroid autoimmune conditions. This panel not only evaluates the normal range of labs, but also looks at suboptimal levels that have been associated in clinical studies with symptomatic expressions of functional or subtle or even gross thyroid disease in the normal range. So if you just order these three tests, TSH, free T4, and free T3, even if you only have two of them, if your patient comes to your office and says, my endocrinologist did a TSH and free T4, or my functional medicine doctor ordered free T4 and free T3, that's enough information to run the panel with partial results. And we'll offer an interpretation, and we'll talk about if it's suboptimal, optimal, or low. And then there's an interpretation guide, which can say, this is associated, for example, with functional hypothyroidism or central hyperthyroidism with peripheral hypothyroidism. And then there'll be a treatment guide, which will talk about how to adjust medications for patients on medication, what type of plants would be appropriate, minerals, drainage approach, diet, etc. I don't want to spend too much time on this, but this is just to demonstrate to you the cost efficiency and the time efficiency of the GEMMA biomarker analytical approach versus functional medicine labs. This isn't to say that a person should not use functional labs or that they're not useful. I use them maybe about 10% of the time in my practice, but I find that ordering these endobiogenic panels with the GEMMA system and some very simple elements of history and physical can give me a lot of information in a short amount of time at a relatively low cost compared to doing a quantitative measurement and waiting several weeks for the results to come back. So another way to think about incorporating endobiogeny and this analytical method is that because many of the tests that we offer only require a simple blood count, which takes 24 hours to be resulted, and the patient doesn't need to be fasting. It could be used as a screener and a way to establish a first level of treatment while you're waiting for a definitive quantitative test to come back. So I just wanted to end this conversation here on introducing endobiogeny by talking about Dalmatian or garden sage, Salvia officinalis, which I think is called Shenreg, and just kind of show how we would overlay the concept of the action of a plant on this model of the neuroendocrine system in these emunctories. So we have here the estrogenic actions, which could be characterized as restoring the uterus. We have this action on supporting the thyroid system and the adrenal system and building qi. We have its actions on opening the mind and improving memory and mood. We have the action that's characterized as calming Shen through the parasympathetic nervous system. And we have its actions on breaking up blood stasis by supporting the liver, metabolism, drainage, digestion, and correcting and balancing issues of inflammation and mucus. Rachel and Susan, do you want to comment on this point, on these characterizations?
I love them. I think we should have a whole Materia Medica done this way.
Me too.
As a group concept. It'd be so great. I've often tried to characterize herbs that we use, or even formulas. Yeah, so this is beautiful. I love it.
Thanks. Susan, anything you'd like to add?
Uh, I agree with Rachel. I think a Materia Medica would be great. And it would really be helpful because I use a lot of these correspondences when I'm thinking about treating a patient, but this really helps clarify it.
I hope it's a project that we can develop together. Right. So we'll just wrap up here on this part. Why would endobiogeny benefit the practice of someone who's engaged in East Asian or Southeast Asian medicine? Well, endobiogeny is transposable onto your current expertise. It's not imposable because it is fundamentally a way of intaking and analyzing information across different modalities of thinking, Eastern and Western, quantitative and qualitative, elements, and physiology. There's a flexible system. You don't need to do a full history exam or biomarker analysis. We have many very competent practitioners of endobiogeny who only use two of these three. Maybe you have a remote part of your practice which is remote, and you can do history and biomarker analysis. Or maybe your practice is all in person, but it's not structured in a way where biomarker analysis is feasible because of your scope of practice or ordering privileges, but you could still do history and exam and have an excellent endobiogenic practice. Endobiogeny can help expand your knowledge base and it brings insight and deeper knowledge from a novel perspective. And it improves communication with patients and biomedicine allies that are rooted in these physiologic notions. So it's easier to convey what you're observing from your Chinese medical perspective or other East Asian perspective, because you have a language that your biomedical allies are already familiar with, like inflammation, histamines, stress hormones, etc. Brigitte, are there any questions from the group that we want to take before we briefly talk about the Science of Endobiogeny course?
Currently not that came from the chat box, but people, I wanna all attendees let know that there was a chat enabled, but now it's available to be used. But there was a question from the past, but I think you already answered. How can I use this work if I'm not licensed to order blood work? And as you just said, like you can use other tools of endobiogeny.
Yeah, I would say there's a couple of ways, and I think Rachel and Susan can also address this from their experience. The first is just purely working on anamnesis and semiology, so history and physical exam is how endobogeny was initially taught, and for the first 10 years or 15 years, that's how Rachel started studying endobogeny. There was no blood analysis at that time. The second is your patient may have a relationship with a biomedical physician, so a medical doctor who is ordering labs, or a naturopath, or a naturopathic doctor, or a sage-femme. Rachel help me out. A midwife.
Life, midwife.
Yes, midwife. I'm just thinking in French for a second. A midwife who has can order labs. So building these bridges with allies and working together is another way. And the third way is that your patients can bring labs that another practitioner has ordered, and they trust you. They trust you because you listen to them, because you hold space for them. And that trust inevitably leads to them saying, I have these labs, I don't know what they mean. And entering them into the GEMMA bioanalytical system, I believe, allows you to stay within the scope of your practice, because the analytical system in endobogeny is not commenting on the labs, the biomarkers themselves, which would be the practice of medicine. They're commenting on mathematical relationships between the biomarkers, and they're commenting on an index, which is a unique formula looking at these relationships between biomarkers. And the comments in the GEMMA system are commenting on the underlying physiologic tendencies and not talking about pathophysiology. So these are the ways that you can gain access to labs and talk about them within the scope of your practice.
There are two more questions that came in a Q&A box. I wonder if you can open them up and see yourself.
Sure. Our friend Dr. Kitata from Tunisia asked, can we explain in Eastern medicine the first and second loops? So I haven't gotten into this, but the image I showed you, the animation with the 4 families of hormones, the same 4 families appear a second time in what we call a loop, with different hormones within the family being active in the first time and the second time. I'm not expert enough at East Asian medicine to describe it, but I think it has to do with the cycle of control in the 5 element systems and where you are in that cycle of control. Could either of you comment on that? The loops in endobogeny and the cycle of control?
I think that there's a synthesis of that with also ideas of different layers of the constitution. So we have the Wei layer, we have the Yin nutritive layer, we have the Jing layer. And so I think that the loops provide us with a kind of dynamic endobiogenic look at the relationship between those layers and how the ecosystem is responding in its own characteristic way to whatever the disharmony is. So I think it's probably a combination. Also, we have ideas of regular meridians and extra meridians. So I think that the loops also can explain sometimes what we view as certain conditions that have evolved to an extent that we're off our regular loops, we're off our regular meridian activity, and we're beginning to enlist, or we would say in endobiogeny, to solicit action from the divergent meridians or the prenatal meridians in an imbalance.
Well, yeah, we would say adaptative way.
An adaptative way, yeah, adapting to the adaptation, yeah. So I think the loops very well model that. And I think what Kamyar, you were saying about the call and response, we also have ideas about that in Asian medicine. So because we have expectations of what constitutionally a person would be engaged in as a response. And so we're constantly making quantitative evaluations through things like pulse diagnosis and tongue and narrative to see whether our expectation of a system is behaving in sort of animistically in ways that are harmonious or not.
Thank you. Susan, would you like to add something to that?
Yeah, I was just I believe the loops definitely correspond to divergence that we use in Chinese medicine, so that's a little more classical. But often, and we're also looking at the compensation. So with the loops, are similar to different levels of I want to say like we'll have confluences that go address certain things or use certain mediums, but there's definitely, it is a compensating mechanism that relates very similarly, that helps us understand the whole idea of loops in endobiogeny. Does that, if that makes sense?
Yeah, thank you. Thanks for enriching this discussion. Bashak, our friend from Paris, asked, will there be a module or something specifically related to Chinese medicine and endobiogeny? Well, I'll get into the science of endobiogeny course as our next subject. Let me just say that as we build a critical mass of experts in East Asian and Southeast Asian medicine who take our course, I would like one day together in committee and as a group to develop a course teaching endobiogeny with clear correlates to these principles of the pre-modern whole systems medicine approaches. The first step that we've taken in the meantime is that in the GEMMA bioanalytical system, there is an optional space to enter a Chinese medical term, either using the what do you call it? The transliterations of the Chinese or an English equivalent of it. And we'd like to build up a database where we can start to correlate. So for example, if you're ordering the adrenal balance panel, or your patient is presented with a CBC with differential that somebody else did in an investigation, let's say for fatigue, and you run it through the panel and you find that this person has excess yang, or they have a yin deficiency, or however you would characterize issues related to their fatigue. If you can enter that in the Chinese medicine box, we can start to build up this database and see when indexes tend to be high or low or have this relationship, this is definitively associated with such and such term. So in the future, I hope for us to have an explicit course. Well, let's talk about the science of endobiogeny course now. This will be shorter than the first part of the presentation. It's a 6-month course. There's 1 module per month with 2 to 3 topics per module. It includes 3 different types of learning. There's a guided, self-guided experience, which is reading this book, The Theory of Endobiogeny, Volume 1. And we will provide in our learning management space for you self-assessment quizzes, and each answer has a page and a quote from the book where the answer can be found, so you can go back and reread and deepen your learning and comprehension. The second level of learning is didactic. We'll have live lectures that are recorded. You can participate in the live lectures, or you can watch them at a later time, or you can rewatch them even if you attended it live, and there'll be an opportunity for open discussion, question and answer, just like we're having today. The purpose of the lectures is not to teach everything in the chapters you've read, topic by topic, but to explore the essential concepts and to open up and deepen your understanding of the most challenging concepts presented in a chapter. The third is experiential, because on a Saturday once a month, we'll have the didactic lecture. And on the following day, the Sunday of that same weekend, we'll have an experiential lab where I'll be teaching a JEMA panel, one of these ways of analyzing the blood work that immediately applies some of the concepts that you've been spending the month reading about and you spent the previous day hearing about in a didactic fashion. And we'll learn how the panels are constructed, we'll navigate our way through them, and we'll also learn them through case studies. At the end of the 6-month, 6-module course, there's optional testing for certification and the receipt of the diploma. I'm going to come back to the diploma in a moment. Let's just briefly go over the topics. Module 1 is fundamentals of systems thinking and the elements of the terrain, just like I presented today, the nervous system, hormones, the emunctories. The second module is the hormones of adaptation and catabolism, specifically how the body adapts to stressors. The third module are the hormones of recovery and anabolism, as well as learning about these neuroendocrine combinations in physiology and pathophysiology. The fourth module are the essentials of the clinical practice of endobiogeny, so history taking, the art of the exam, etc. The fifth module is learning about the biomarker modeling, understanding what each of the individual biomarkers is representing alone or in combination, and we'll go a little bit deeper into the JEMA panel analysis. The final module is the philosophical and practical approach to therapeutics, and we'll learn how to analyze multiple panels together. Okay, so the final examination, you have 3 months to take the exam from the end of the course. And the pass rate, is 70%. Distinction will be 80 to 89.9%, and honors will be greater than or equal to 90%. We want you to pass this course. We want you to be diplomaed and certified, and we're here to help you be successful. Now, there are 3 different pathways that are open to you. Of course, there's 4. The fourth is you audit the course and you don't want to take the test, and that's okay. We're happy to have you. If you want to be certified, we have a multiple choice exam that I mentioned as a 70% pass rate, and you'll receive certification in the science of endobiogeny. The second pathway is to take the exam and write an essay on a topic that you will be assigned. I'll personally assign the topic to you in a way that's personalized and can help you grow based on your interests. And in this case, you would have a diploma which says Certified Mastery in the Science of Endobiogeny. The third case is to obtain a diploma called Exceptional Mastery of and Contribution to the Science of Endobiogeny. And here you could choose to publish a monograph or a case study. And in either case, myself and my team in our research and development department will make ourselves available to you to help structure the monograph, the case study, to assist you with the statistical analysis and with writing a manuscript and making sure that it gets published. Okay, so the tuition includes all the course material, an ebook of the Theory of Endobogeny, Volume 1, supplementary material, which is optional to read, the workshops, the case studies. It also includes a 6-month subscription to the GEMMA bioanalytical system, a membership at the Explorer level, which allows you to do 5 panels or 5 tests per month at the level 1 level. There's an early bird special I'll talk about where you can activate this longer for an earlier before the course starts, or you could also get a bonus month of membership. You'll also have access to the course videos for 6 months after the course ends. And as I mentioned, there's the certification testing and the certificate, the diploma. So we currently have an early bird special. We have 2 specials. The first one ends March 15th. So it's going to be the end of this following week. There's reduced tuition, the option for split payment options. You get a bonus month of the GEMMA subscription to Explore. You need to register and pay by March 15th and sign up for the GEMMA system if you're not already signed up by the 29th of March. And we'll also be sending our early bird registrants exclusive bonus material. Between March 16th and April 15th, there's still reduced tuition and a split payment option, and you can start your 6-month membership with the GEMMA Explore plan early if you want. You can also upgrade and you can use the credit of GEMMA Explore to a higher level if you are really excited to explore this on your own before the course starts. So you can register at training.systemsvrg.com, and you can go to our mother website, systemsvrg.com, to learn more. You can look at interviews, testimonial videos. We have a free periodical that you can read called Living Systems, which is kind of like an introduction to endobogeny at a level which is friendlier and helps bring you into our way of thinking. There's also research articles if you want to look at our research into validating the different formulas that we have. And you can go directly to gemmabio.com and take a look at the system there. Okay, are there any questions about the Science of Endobogeny training course before we begin our conversation?
Not at this moment.
Okay, so let's have our conversation now. So I'm going to address these questions to both of you, and feel free, whoever wants to share your thoughts. Can you tell us about your training and your journey as a healer?
Rachel, do you want to go first or should I?
Go ahead. Yeah, go ahead.
Oh, okay. My training, I went to Pacific College. How do you want to know how I got into it or just my training?
Whatever you feel called to share. I think we want to help establish your life as a healer, your work in Chinese medicine, and how you came to endobogeny. But that'll be the second question, is how you came to endobogeny.
Okay. Well, I was helped like soon after college by natural medicine. And so I was fascinated by it. And then when I was I was in a second career switch. I ended up in grad school for landscape architecture and went on a trip to Central America where I met Rosita Arvigo, who was a natural healer who had studied with a shaman. And that really piqued my interest with herbs. In fact, some of the herbs helped me. And just kind of get through the trip. And that kind of led me into I found more of a fascination with the plants. And an internship through this program led me into, I stumbled into Chinese medicine actually, trying to learn more about the herbs. And then I decided to get treated, and I found it very helpful. I kept going back. So they were just starting Chinese medicine in New York. It had just that year been approved for licensure in New York. So I decided, you know what, I want to give this a try. And I took a leave of absence from the graduate program I was in, started Chinese medicine, and kind of never looked back because I was so fascinated, and I just found it very helpful. So I graduated in 97, and so I've been working quite a while. And so I was asked to teach in Jeffrey Ewan's program in 2001. So I was there for a while, and also, but how I came into endobiogeny actually was with Rachel. Uh, I guess I've been practicing about 13 years. My father passed away, and I had a pain that I couldn't get rid of. I was a little worried about, I didn't know a lot of people were getting cancer around me, including my father. And so she suggested endobiogeny as a way to looking deeper into the body and maybe seeing something that, you know, maybe would give us more insight. And so I decided to do that. And we did the lab work, and she came up with a formula, and I noticed a big change. It was gradual, but from the time I first started taking the endobiogenic formula, I felt a relief come over me. And that led me to want to try, have my family do it to see if it could help them. And then Rachel mentioned that you were giving there was going to be a course in it. And so that's when I first went out to California to study with you. And yeah, so that was my path, and I've definitely found it useful. I do refer patients to it, but it's also helped me understand Chinese medicine in a deeper way. In other words, like through pulse interpretation, I feel like I'm able to understand more of what's going on and also how to treat it, even understanding the endobiogeny. I also see a lot of correspondences from endobiogeny, for example, the buffering zone, and we talk about source qi and a reservoir of qi when we're talking about 8 extras. So I do believe there's a lot of correspondence, and it's a good fit.
Thank you, Susan. And Rachel?
So I began my journey with Chinese medicine through shiatsu. It was something that really, really helped me to overcome a chronic illness. And so then I had been interested in medicine as a young woman, and my own healing process with shiatsu and herbs actually brought me to a really deepening passion to want to practice medicine again. And so my shiatsu practitioner brought me to her Japanese teacher, and I did a traditional apprenticeship in shiatsu practice with him. And he was from a little island in Japan, but he also practiced acupuncture. So that's when I received my first acupuncture. And he kind of like a diagnosis, felt that the way that I constitutionally thought about healing could be a good match to Chinese medicine. And he had a colleague, Jeffrey Ewan, who at the time was teaching in Chinatown. There was really no real regulation around it in New York. You could become a licensed in acupuncture as an MD, but there was a kind of grassroots movement also because so many people had come here from China and were practicing Chinese medicine, there wasn't any real legal structure to welcome them into licensure. So Jeffrey had been taught by his grandfather, and he was teaching in the elementary school down in Chinatown every day of the week. And if you were to study with him, I was brought to him by my Japanese medicine teacher, and I just began to show up literally. And he had a very Taoist and poetic, but also deep interest in neuroendocrine system theory. So I think from the beginning of learning with Jeffrey Ewan, who was and is a Taoist priest, there was a kind of thinking that was going on in the teachings that relates to the neuroendocrine system and the autonomic nervous system. He was very much many of the practitioners in the classes he was teaching were massage therapists in the beginning. There weren't any acupuncturists. We were all just healers and massage therapists. And he taught us herbs, and it was, years of kind of just showing up. He kind of had a unsaid requirement that you would also cultivate yourself. That was a big, deep teaching of his. So there was a lot of emphasis on Tai Chi, Qigong, and on, getting to know your own system as best you could, because he felt very deeply. And I think that this also relates to endobiogeny, that it's the self-cultivation of our own being as mammals, as ecosystems inside of our ecosystem, that creates the relationship with the patient. And so the idea was that you had to continually cultivate your own energy and understandings as part of the development as a practitioner and as a listener. And so slowly I learned acupuncture, having first learned the meridian system through shiatsu. And Jeffrey was very engaged, and I know Susan knows this too, in the use of essential oils on acupoints. He's taught on this extensively. He was really an early pioneer, I believe, in it. And that led him, I think, to a lot of, different writings that led all of us to them. And at some point, Eve Rakena, who was a medical doctor, but had also written a book on Chinese medicine called Terrains in Acupuncture, we got him over to the States to teach some seminars. And Jeffrey actually even attended these seminars. They became very nice colleagues together. And it was kind of the beginning of the opening between the French physicians who were terrain-based and acupuncturists here. And I think it was a really rich time. Dan Kenner was very much involved, the late Dan Kenner, who I just want to say was definitely part of my path and part of my development. He wrote a book with Dr. Rakena on endobiogeny and essential oils. And that was like a Bible for us. And at the time, also, my colleague Tuvi Luong, who was an acupuncturist who had also studied with Jeffrey, was fluent in French. And we were kind of begging her to bring back the French books that Jean-Claude and Durford had written, including a whole set of cahiers of notebooks on their practice and their observations. So we were studying endobiogeny to be able to use essential oils. And it helped us dare to begin to even use essential oils internally very carefully with Jeffrey's guidance and with the study that we were doing through the works of Lapraz and Durford. And so we began to see incredible results with tiny nano doses of essential oils internally. And there was even a woman who was a colon therapist who became an acupuncturist who was using them in her colon therapy. And we were seeing incredible accelerations of healing through the use of essential oils. So my training, eventually there was a small group of us who had apprenticed with Jeffrey, and he was recognized by the state when we began to get board to create an acupuncture board and begin board certifying and licensing acupuncturists in New York State. Jeffrey was recognized by the board as an authentic teacher, and they decided to have a small group of us who'd been with him for years be grandfathered in because they knew we were well educated so long as we passed our state boards and practiced under a physician for a time. So that was, I think we were 7, and I was one of the 7. So that's how I came into acupuncture and Chinese medicine, yeah, and endobiogeny. Yeah.
Thank you, Rachel. I'd like to pick up on something that you mentioned and that Susan alluded to, which is how she came to endobiogeny, which is this notion of self-cultivation. Now, of course, endobiogeny is not like the Taoist tradition where, we have movement exercises or something like that you're doing. But my observation for myself and my students is that the first patient, patient 0 is ourselves. And those who go on to practice endobiogeny clinically really explore themselves through the cosmologic lens of endobiogeny, and they cultivate an endobiogenic spirit. I'd be interested to hear for each of you how this cultivation within endobiogeny occurred for you and how it changed you.
Well, I can say that was profound change. When I began to actually utilize endobiogeny in my practice, first being mentored by Annette Davis, and then later entering the fellowship, I was exactly at my change of life point. And so I began to get to know myself through the indexes and through my endobiogenic treatments received through my change of life. And it was such a harmonious process. And I had seen so many patients go through it in a very difficult process. So I feel that the understandings that the endobiogeny gave me about that stage of life, and that's something I want to really emphasize in terms of a great gift that endobiogeny has given me as a practitioner, is that not only do we understand the patient at their particular moment of disharmony, or for whatever reason cause they seek our attention, we're also seeing them inside a phase of life, which of course is in Chinese medicine, but in endobiogeny there's such an elegant elucidation of different phases of development. And so I got to go through my change of life with the assistance of herbs, and also get a self-reflexive understanding of what stages I was going through, and was actually able to understand how I was adapting to this change. And I was able to understand what the next development should be. And I do think there are correlations. So, for example, in Chinese medicine, we say that after the reproductive years, there's an emphasis on structure. There's an emphasis on that our biology comes to be a time of cultivating our bones and keeping our mind strong and developing our spirit. And so I can see from the many women I've guided through endobiogeny now through menopause, and from my own encounter with it, that there are shifts in the terrain that happen where the loops and the engagement of the loops have to do with beginning to work on maintaining the anabolism, maintaining the structure without the activity of reproduction. So that was really a deep teaching, and I can continue to learn from that. And then the other thing that I know Susan and I have talked about so much along the years of being colleagues of endobiogeny, I just felt that my creativity opened up in a very deep way. So I was able to complete, just different projects that I had. Uh, there was just a kind of more sense of engagement and more understanding of how to engage with this particular phase of life. So that was very surprising and wonderful too. So yeah, yeah. And endobiogeny being an open system and doing my own regular endobiogeny assessments has just helped me to be able to embrace, where I am, exactly where I am, and continue to develop even if there are challenges there.
Before we get to Susan's response, I just want to clarify something from Rachel's rich response here. Those of you who, I know we have so many guests with us today who are already endogenous, and I cherish their presence. They know what you're talking about. For those of you who are pondering or planning on joining us for our next fellowship, when Rachel, and I'm sure Susan will elaborate on this, we talk about how endobiogeny changes you, it's not a magic amulet. It's because as you analyze your own blood work, as you understand where you are in the phases of hormonal cycling and how that lines up with other time-based events like Saturn's return, like the emancipation phase, when you start to understand what certain hormones correspond to, because all hormones have receptors in the brain and they affect specific areas of the neuroanatomy and they alter the conscious mind's perceptive abilities. And so when we're able to say, why am I stuck at this certain way of thinking? There is a neuroendocrine correspondence to uh, challenges in the way we think, or repetitive thinking, or uh, self-limiting beliefs. And these can be shifted by selecting the medicinal plants or other interventions that can help the corresponding neuroendocrine and the central nervous system neurotransmitter imbalances that are related to the tendency to think or feel or respond in a certain way. And of course, there's a psychology of illness and the way an acute or chronic illness affects us. And the ability to shift that subtly but persistently, as Susan noted about her own experience with her first endobiogenic tinctures, is part of the opening up to this belief in healing and a type of liberation into the possibility of thriving. I think these are some of the ways that when we talk about endobiogeny changing us, this is how it occurs, because we're working with endobiogeny and endobiogeny is working on us. And we become better healers as we become better and more whole human beings. Susan, what would you like to add to this about how endobiogeny has changed you?
Well, I endobiogeny initially also really helped me with my blood sugar. So I had a blood sugar issue that I was treating with supplements. But once I found that endobiogeny not only helped me with my blood sugar, but also, again, opened me up to like changes in my life. I want to say I definitely helped me feel stronger in myself so that I was able to make like some major changes in my life that were freeing, and I want to say helped me come into my own. So I'm very grateful for that. And what did I want to say? Yeah, just like it helped open up possibilities that I had never thought of. Um, so I really have made some major changes in my life. And let's see. Yeah. And I just wanted to mention, and with that first group that we started with back in 2012 in Solana Beach with endobiogeny, I've not only seen big changes in myself, but I know most of the people in that group went through major changes also in a very freeing way. So it is really interesting to watch. And All I know is I feel it has helped me and probably most of us uh maybe peel off some of those layers, like you were saying, ways of thinking, but that has helped us be more of our true self.
Yeah, because the non-deterministic approach, those of you who have studied with me or with Jean-Claude know that when you ask a question, the answer is probably it starts with it depends. And this openness to not be judgmental or categorical, the quest to find out more, to remain open, it's not just for the bedside. It's how we listen to ourselves. It's how we relate to our partners. It's how we relate to our children. And this is, I would say, how endobiogeny really changes us as well, because we take these tools of clinical reflection and we start to apply it in our life. That's the most fundamental thing. But those of you who have had private training sessions or extended training with me or with Jean-Claude know that uh, there's a way to apply endobiogeny specifically to these key periods that I showed on the screen earlier about these changes in life. These changes in life are driven by shifts in the endocrine system. So one of our great pleasures is to bring this reflection to toddlers going through the terrific twos and exploring ego identity and capability, and to tweens and adolescents, and to young adults going through their emancipation phase and entering into gonadopause, and looking at this as an opportunity for new possibilities rather than a crisis that just needs to, where symptoms need to be suppressed. So I hope one day we can have a master class and formally teach the approaches to the stages of life. But we will explicitly talk about these stages of life, exactly as I showed them in this course, The Science of Endobiogeny. And it's important to lay that foundation so we can get to this higher level of practicing endobiogeny beyond sickness, but to work with human potential and to go again from striving to thriving and from thriving to flourishing.
Kamyar, do you see the new questions that came in Q&A?
Yeah. So I'm going to hold off on Bashak's question. We're going to come to that a little bit later. Our friend, Dr. Nenchu, I believe from Romania, says, is endobiogeny a science or more than that? It seems to be more than a science. So I appreciate that question. If you go back and rewatch the second slide with the animation, endobiogeny with a capital E is a is a is a philosophy of science, and it's a philosophy of life. It's about seeing the whole and the parts, and that's not strictly related to the biomedical apparatus of biological life. Endobiogeny with a capital E is the basis of the theory of endobiogeny and clinical endobiogenic medicine. The theory of endobiogeny is a scientific approach. It has a series of rational posits. These posits are then created into a theory. The theory is then validated through clinical observations, empirical observations, and experimentation on animals and in human subjects. And then it is further validated through the clinical practice observations and by quantitatively tracking the evolution of these mathematical markers of physiologic activity. So if we have a theory that's based on clinical observations of the different elements that contribute to the expression and the circulation of histamine. And from these clinical observations, we created something called the histamine index, which is a way to model the general circulating rate of histamine activity systemically without measuring histamine in the blood. Now, there's a theory, there's a mathematical formula, there's a correlation with symptoms, and then you offer some type of treatment. it's quercetin, it's vitamin C, it's lavender, it's burdock, it's something else to regulate the allergic terrain, to stabilize mast cells and the release of histamines. And then the patient comes back after some period of time, let's say 3 months. They repeat their blood work, and you repeat the modeling of the histamine index, and you see that it's reduced by 75%, and you see that their symptoms have either completely resolved or are significantly improved. There's a subjective expression of symptom improvement. There's an objective quantitative expression of the histamine reduction. So the theory of endobiogeny and endobiogenic medicine is a scientific approach. But all science is really the art of philosophy and practice, as far as I'm concerned. And any science which is not rooted in a comprehensive cosmologic understanding of how things work is ultimately doomed to fail. I'll tell you just a short story. So this is not the forum for me to tell you about how I came to endobiogeny, but I'll just simply tell you that I was trained at Stanford University in pediatric intensive care medicine, and we were doing all sorts of exciting things, and we were trying different things, and we were in a situation where we had to save children's lives. And I would ask myself, and I would ask my brilliant professors about why children got sick and why certain children were repeatedly ill and why some responded to our therapies and others didn't. And the only answer that anyone ever gave me was genetic polymorphisms, and they just walked away. You know, SNPs and genetic polymorphisms are not enough to answer this question. And I actually review the clinical studies and the failure of this concept of genetic polymorphisms in the book. Actually, you'll read it when you get the Theory of Endobiogeny, Volume 1. I simply want to tell you that that's what started my moment of crisis to say, you know, nobody's captaining the ship. We don't have a comprehensive notion of what life is in biomedicine. It's simply some type of phenomenological reactive series of events, and we're playing whack-a-mole between pro-inflammatory cytokines and anti-inflammatory cytokines. And, you know, in the first 3 months that I was at Stanford, one of the junior professors was so excited. He said, hey, we're enrolled as a center in a multi-center trial in blocking the expression of nitric oxide in septic shock, because nitric oxide vasodilates and leads to vasculatory collapse and organ failure. And I was wet behind the ears. I just came from my general pediatric residency training, and I said, okay, well, maybe I don't know anything, but I read about nitric oxide, and I know that it is expressed in every cell and throughout and every tissue in the body, and it does a lot of good. And I just thought to myself, if you block it everywhere when it's only a problem in a specific place, it doesn't sound like a good idea. Well, like 2 or 3 months later, with this ashen look on his face, the same attending ran in and he said, stop the trial. Don't give anybody this medication. We did, an intermediary analysis of the preliminary data, and we've increased the rate of mortality. You know, it's these types of things that made me realize that, look, there's science, but science is itself the art of philosophy and practice. Okay.
I would like to bring two questions that came
Sure.
prior. So we spoke about how endobiogeny enriches the practice of medical doctors or East Asian medicine specialists. But what about the midwives? What about the dentists? How can, or therapists, can it be used there? And what's the way to enhance it?
Sure. Well, again, endobiogeny with a capital E is just it's a philosophical approach to being open, to being non-categorical, to speaking in probabilistic terms. The theory of endobiogeny, because it deals with living systems and biological life in human beings, is completely applicable to all fields where people deal with body or mind. So yes, it's applicable to midwives. For example, we have a whole teaching on the physiology of parturition. I have a whole teaching I've given, like a little master class I've offered my students in the past on the endocrinology of fetal development. Because of my training in pediatrics, I studied a lot of developmental physiology to understand these inborn errors in metabolism and other issues related to early childhood disorders. So yes, endobiogeny touches all phases of life from and actually just to understand the endocrine system and disease modeling, we have to understand the embryologic layers. And we talk about that quite extensively. Is what would the other fields therapists? So does that mean like
Therapists,
psychological counselors?
yes, psychological counselors and also dentists.
Yes, of course. So we've begun teaching endobiogeny to holistic dentists in Korea. And of course, we have the fabulous Dr. Mona Moy, who as a holistic dentist has been studying with us for quite a long time. I believe that it's totally appropriate for dentistry. Again, I'll just take you back to before residency in medical school in Detroit. I had the very good fortune. We had a medical school which believed in the sort of cross-fertilization of ideas. So on the pediatric ward with me were dental residents. And it was listening to them that I first heard that, systemic health affects the oral cavity and oral health affects the systemic body. And now the science is so well matured since I first heard about that. So I would say we have, not only is it appropriate for dentists to study endobiogeny, we need more holistic dentists because we need to create allies who are specialists. Because sometimes it's the dentists who are going to notice something in the mouth that's related to systemic disorders. And sometimes we need to send patients to them. Or people have chronic pain and it's not enough to give them California poppy or give acupuncture because really there's a mechanical structural issue, and that originates in the dentition and how the jaw is functioning and how people are masticating. So again, we need our colleagues in osteopathy and holistic dentistry to work with us. And for therapy, those of you who've either been treated by me as a patient or studied under me know there's a very clear pathway between the indexes and the psychophysiologic states of individuals. And I'm very keen on treating those states and accelerating the rate and the success of therapy by using medicinal plants, vitamins, minerals, amino acids as our allies to help people open up to greater reflection, to greater states of neurostability for introspection and life changes.
I just want to add in terms of perinatal health that I've collaborated very intimately with midwives and also with fertility experts over the last many years, several decades. And I mean, this isn't a formal study, but I have been able to, I feel, fairly well predict women who may be more prone to morning sickness through the loops of endobiogeny, women who may be more prone to miscarriage in certain cases, or if they've already had miscarriages, to be able to identify ways in the terrain to correct that. So, and then over the last maybe 7 years with the insights from endobiogeny, I've been able to also really successfully treat postpartum depression and to, in many cases, when women have a strong history of postpartum depression, be able to, before and during the pregnancy, prevent, I believe, postpartum depression, which is becoming more epidemic. So I do feel that endobiogeny has so much to offer healthy perinatal care without having to resort to medication, and which would then, cascade into the infant's physiology. So I feel like we need every midwife to get basic understandings and to be able to be a little bit ahead of the development of certain things that are common, like gestational diabetes, for example. Also, we've been able with endobiogeny to get a foothold before it sets in. So I just wanted to bear witness to that.
Yeah, in my practice, it was routine for me to do preconception biology of functions work on the diet and the physiology to optimize fertility. And then in each trimester, I would do a biopsy of functions. And then in the first 6 weeks postpartum to monitor for postpartum depression, for hair loss, eyelash loss, other issues, and of course to work on milk production when that was an issue. There's so many ways that we can help. I've also treated, when we have a prenatal diagnosis of Down syndrome, for example, trisomy 21, we can start, because we understand the physiology of the child and adult with Down syndrome, we can start to work on their perinatal physiology in utero by offering these plants to the mothers, and the outcomes are fantastic. So yes, there's a lot in this field. And the more people we have and the more we have this, I think if both of you could address this, from the people you met and have stayed friends with in the fellowship, I think there's a very in every country, there's an organic network where people start to lean into each other's expertise and to help each other out in challenging cases, because you share the language of endobiogeny, and then you have your own specialties and you have your own paradigms. But this center point of endobiogeny is like a hub, which brings all the spokes together and then allows that information to go back out. Susan, do you want to say something about these topics?
Uh, yeah, I mean it's wonderful. I know I have collaborated with a few of the people in endobiogeny that we started with, or even in the second cohort. Um, and I found it's wonderful to have that ability to kind of understand a similar language. For example, Madhu is someone, so she's a pediatrician who I've brought my children to, but also studied endobiogeny, and we can talk about approaches that maybe that it will help the kids that maybe I don't have that pediatric medical understanding, but we have that common language. So we're focused on more of a natural treatment. And she has her background and I have mine, but again, that collaboration is really helpful.
Kamyar, there is a question not going too far from a midwifery approach. How can you achieve improvement in a genetic damaged fetus?
Yeah, thank you, Claudia, for that question. Even when there are genetic disorders of inborn metabolism, there are compensatory responses which the body will undertake to try to manage the absence or the overexpression of certain proteins or factors. So, for example, human beings with trisomy 21 have a weak pancreas and they develop an excessive parasympathetic tone. That's why the majority of, and they develop a high prolactin and growth hormone expression as well, all related around this issue of digestion and growth. That's why they tend to be overweight, and they tend to be passive and smiling. And then there's a subgroup of them who tend to be actually very aggressive, because that high parasympathetic tone drives the triadic relationship of para, alpha, and beta into the adrenaline. And the adrenaline leads to these sudden bursts of activity, of irritability, with certain hormones like DHEA also playing a role in neuroinstability. So when you understand this, then you can start to use medicinal plants or digestive enzymes that start to help the mother's parasympathetic system and the vagus nerve maintain an optimal level of tonicity of function. And this will invariably enter into the fetal circulation and start to help regulate the compensatory vagal tone in the unborn child. And then again, in the first volume, I'm sorry, it's actually in volume 3. It's an advanced topic. but we reproduce some studies that show the actual onset of the development of certain pancreatic enzymes in the infant in the first 12 months of life. So based on that, I've developed an endobiogenic approach to introducing first foods that do not overtax the pancreas. And then we can take that to another level for the patients with trisomy 21, because we're going to be very meticulous to avoid fruits, for example, pureed fruits as their first meal, or we're going to avoid rice, like white rice porridge, for example, as their first meal.
So it seems an endobiogenist is not afraid seeing a genetic diagnosis of a patient. For many doctors, you see it and it seems there is nothing you can do, only treat the symptoms. But for endobiogenist, you have a lot of tools to help the
That's
patient
right.
and family.
You can always treat the compensatory and adaptive responses. Go ahead, Rachel.
I just want to bring up a case that I had referred to Kamyar. I don't know if it was ultimately a genetic expression, but there was a woman in my practice who was pregnant with a child that was diagnosed with a heart defect that was going to need immediate surgery upon birth. And so I sent the pregnant woman to Kamyar, and he treated her the entire pregnancy. And it kind of relates also to the colleagueship idea that this was in New York, and not only did she do beautifully, and she was able to actually have a natural vaginal birth instead of a C-section, but at the same time, through our colleagues, we were able to set up through Madhu Rajaram at the hospital itself the capability for the mother to give colostrum and original breast milk, even though this child had surgery like immediately after birth. And they were even given permission and were allowed to put distilled rose water onto the baby's feet to bring down the trauma. The parents located themselves at a place, a hotel very close to the hospital, so they had constant touch and so on. So I know that Kamyar's combination of having been a pediatric ICU physician, the fact that his father was a cardiologist and he was building hearts when he was a young person, so fascinated with them, and this colleagueship that was able to kind of wrap around this woman's birth. And that child is so like great, like just so untraumatized, even the scar, because in my training, Jeffrey Ewan would say that if a scar was made from a trauma that happened unexpectedly, it's going to create itself with a lot more consequence in the fascia, and in the expression of the scar will block more meridians than if the scar was expected. It was a surgery that was going to be known to happen. So I think the fact that Kamyar was able to regulate the mother throughout her pregnancy, and that somehow the baby's intelligence also maybe didn't have as much of a shock as it would have with that immediate surgery, because of the mothers being on board with it and aligned with it, and in an ecosystemic like community treatment rather than a kind of heroic, just go in blindly and wish for the best situation.
Yeah. Also, I was analyzing the daily CBCs during the recovery period postoperatively and able to give the mother reassurance about the physiologic adaptation response and recovery, and to propose subtle ways to help regulate the postoperative response that didn't violate hospital policy. Yeah.
Beautiful. There is a question from Julie Foster, and she says, I understand there is a correlation between endobiogeny to anthroposophic medicine. Understanding biography also seems similar to the 7-year cycles, to the 7 major planets and 12 zodiacal gestures of the human to the microcosm. I sense endobiogeny fits here too.
I have patients undergoing anthroposophic treatment who also have been working with me with endobiogeny, and it's a very nice fit. I actually have a very close colleague in New York, Dr. Johnson, and yeah, he kind of loves what endobiogeny has to share about the patients that we've worked on. Also, in anthroposophic ideas of cancer and cancer care, and that people can actually, and that's also true from Jeffrey's care of cancer, our Taoist master, that you can evolve even within a chronic disease, which is so deep in the anthroposophic idea that it's not a chronic, an encounter with a chronic disease doesn't mean that you're not continuing to evolve within it when you have good care. Yeah.
What advice would either of you like to give to your colleagues who might be thinking of taking our fellowship in the Science of Endobiogeny course, especially to junior colleagues? Susan, let's start with you.
Well, again, I feel that it's really endobiogeny has helped me understand in a deeper way my patients. Whether it's just, so I supervise the clinic at Columbia, and often I use pulse diagnosis to really kind of understand what's going on with the patient, and especially what they don't tell us. So it helps me know what questions to ask. And I'm teaching this to the students, and often there's a correspondence. For example, when we're feeling the kidney yang pulse, that translates into the adrenal pulse, which translates into, a lot of times we're looking at cortisol, for example, like we were just discussing this yesterday in clinic. So I guess what I'm saying is it helps me understand on different levels what's going on with the body from a Chinese medicine point of view, but also from a Western point of view, and how we can address it. So again, I feel like it helps me understand, and I can convey that to also other people that are in the Chinese medicine circles, like my interns. How to understand what's going on with the patient and how we can help them, even sometimes help themselves. Improve their sleep, reduce stress in their, in their situation, how to balance their lives. So I find the endobiogeny understanding of it really helps enrich my whole understanding, which helps with diagnosis, basically.
Rachel?
I would just say, don't hesitate. That I think in a way that as Chinese medicine practitioners, we already have this kind of capacity to answer the call to our education. So I feel like if you're feeling called, that you can trust that it will be it will bring new fruits to your practice. And for me, particularly, I feel it's brought such a rich kind of dialogue between myself and my Western medicine practitioners, and help the patients to not feel so split, like they're, over here with their Western diagnosis and testing and so on, and they're over here with their Chinese medicine. There's a way in which we can find language to bridge those and create collaboration, and also to help the patients themselves. I think patients are suffering so much now from being sent to, someone for their arthritis, and someone else for, their menopause, and someone else for, you name it, for their gastric, So I think it's very healing for patients to come into a space where we also have some fluency in the Western medicine diagnostic arts, and we can come in and make our medicine not have to compromise its own integrity. In other words, we can practice from integrity as practitioners of of East Asian medicine, as well as integrity from our endobiogenic perspective. And in that work in ourselves, we can, as practitioners, we can help our patients mend some of this terrible, fracturing that's happening as they're trying to get medical care. And also, I think that if you practice any kind of medicine where you're doing a family practice, that endobiogeny is so wonderful, like to work with whole families to create sort of a better kind of health within the family. And my belief is when we get whole families healing, then we're also contributing to, collective healing on a very deep level where we all need to be working right now. So I feel that ultimately it's a contribution to our troubled world. So yeah.
Well, I want to thank you all for your participation in so many ways, for your presence, for your comments, for your questions, for your enthusiasm. I'm deeply grateful to my friends Rachel and Susan for joining us and enriching this discussion. I'm also very grateful to Brigitte for all of her hard work in organizing this and bringing us all together. And I want to thank Jean-Claude for his patience in teaching me and his support at every step of the way.
Jean-Claude is among the attendees, so
Yeah.
just sweet.
Yes. And thank you to all my patients who were my greatest teachers, and for all the mistakes that were also my great teachers. So,
And I thank you for participating and for having beautiful discussion. I'm gonna put a recording right away for people to access that and rewatch it and recommend to the colleagues. Want to let everybody know that this is the last week for the early bird discount until next Sunday. So this is week where you guys can sign up, save some money, and have Gemma 2 more additional months, in total 8 months of a Gemma Explorer subscription, and you can start using that right away. And so I'll send you emails, and let's stay in touch and support each other, and we're gonna grow a beautiful community.
Thank you, Brigitte.
Thank you.
bye-bye for now.
Bye bye.